Hello and welcome to CityWorks, a co-production of the City University of New York School of Labor and Urban Studies and CUNY TV. I'm Laura Flanders. Every month here on CityWorks, we explore the lives of working people at home or at work in New York and the greater urban landscape. This time, we're looking at an issue many of us know all too well: the challenges of caring for elderly parents or other loved ones. As tens of millions of baby boomers hit their senior years, we are faced with a very real shortage of caregivers. It is a far-reaching and vital topic. With us today to unravel it is Dr. Maggie Ornstein, an expert on family caregiving and long-term care, who teaches public health and psychology at Sarah Lawrence College. We'll talk with Dr. Ornstein shortly, but first, two leading voices on the crisis of elder care in America, Ai-jen Poo and Phillip Thompson, whom I interviewed recently at a CUNY SLU public forum called Reimagining Elder Care: Workers and the Care Grid in an Aging Nation. Ai-jen Poo is an award-winning organizer, social innovator, author, and nationally recognized expert on elder and family care. She's also the executive director of the National Domestic Workers Alliance and co-director of Caring Across Generations. Phillip Thompson is professor of political science at the Massachusetts Institute of Technology and former New York City Deputy Mayor for Strategic Policy Initiatives in the de Blasio administration, where he worked to develop an intersectional agenda for change in long-term care. Here are some excerpts from that forum.
My mother lived with us before my mother-in-law for 10 years. And in the last 2 years, she had home care, and it was a struggle. These women had to travel 3 hours every day just to get here. My uncle's in a nursing home. I went to see him a couple weeks ago, and the nursing home is so short-staffed that in the entranceway, when you open the door, there was a woman screaming on the floor. She had COVID and she was screaming, "Get me out of here, get me out of here." And we had to step over her to even get into the facility, which was a 300-bed facility, mainly of elderly, folks of color in Philadelphia. And the conditions honestly broke my heart.
Yeah.
And it's the system is so broken at every level. And I know I'm one of 25 million people who are taking care of either an elder person in their family or a disabled person in their family. So this is a national crisis that folks just aren't talking about enough.
And Phil, you're actually among 49 million working family caregivers in this country who are caring for an aging loved one or a loved one with a disability and trying to manage work at the same time. And there's nothing in place in our country to support you except for an overworked, underpaid workforce of mostly women and majority women of color, 30% Black women, who are paid an average of $18,200 per year. Imagine trying to support yourself and pay the bills, let alone raise a family, on $18,200 a year. In a place like New York, for example, it's actually untenable. And what we see happen all the time is that we lose some of our most dedicated, most committed care workers to other low-wage service jobs because they just can't make ends meet. And I was just talking to one of our members in Georgia who was working as a home care worker for $8 an hour, and it was such a struggle to manage. She had to every week decide between, do I put gas in my car to get to my clients, or do I buy groceries for the week on $8 an hour? And she finally, it was so stressful for her and her family, she finally decided to take a job in manufacturing that paid $15 an hour instead, even though she was completely dedicated to being a care worker and really saw it as her calling. That's how it is.
In the middle of all of this, we have an election campaign, and a campaign that, not for lack of trying, but this time finally did have the word care in it. Coming out of that campaign, we had a care agenda talked about by the Biden administration and even integrated into the macro version of Build Back Better. For all of that, we give you and your colleagues, your organized folks all across this country, enormous credit. It shouldn't have been this hard, but it was really hard to get that far. I'd love you to talk a little bit about that work, highs and lows thereof. And then, of course, we need to talk about where we are right now.
Absolutely. So what's really extraordinary is that transformative progress has been made. The fact that President Biden, when he was still a candidate, announced that one of the core pillars of his economic agenda was going to be focused on caregiving was already a huge breakthrough. That has never happened before, that we had a leading candidate for president of the United States make caregiving a core pillar of their economic agenda, not their women's agenda, not their family agenda, the economic agenda. And the fact and the way that it was created was actually a holistic approach. It included childcare, paid family and medical leave, and home and community-based care for the aging and people with disabilities. And then the other big breakthrough was that included in that agenda was an emphasis on making these jobs good jobs. That these are jobs that have been undervalued for too long, and disproportionately women of color doing them, and that we have to make them good jobs. And what happened in the course of the administration taking office is that this agenda became a core part of the American Jobs Plan, the American Families Plan, and then what became the Build Back Better Act. We got it done in the House. The House passed a bill, a reconciliation bill that includes childcare, pre-K, making affordable quality childcare much more widely accessible, making pre-K universal, 4 weeks paid family and medical leave, and $150 billion invested in expanding access to home care and raising wages for the home care workforce. And I think if our Senate leadership hears from us about how urgent and important this is, it can still make it onto the agenda. Our elected leaders, they have millions of people calling about millions of different things every single day. And this is something that they need to hear from us about. We all have care in common. We all have care stories. And I think what needs to happen in this moment is to really cement care as a political issue that our elected leaders have to take up and lead on if they want to stay in office or get elected. And I think it's up to us to communicate that message. Otherwise, it's just not going to happen.
Actually, paying home care workers better, training them better, saves a tremendous amount of money. And if we don't have care workers who know how to observe what's going on with a patient in their home, care for wounds, help folks with their, diabetes, take them on walks and do physical therapy, those people are going to the emergency room where costs are astronomical. And that's what happened during COVID. We flooded the emergency rooms. 1 in 5 New Yorkers is going to be elderly within a few years. And if we don't fix our home care system, the folks are going to be flooding our emergency rooms, just like what happened during COVID. And that's what's coming. Meanwhile, there's an extreme shortage of home care workers in New York. You can't find one. And our main training organizations are actually our community colleges. And I went to a bunch of them and said, we have a home care shortage. Why aren't you training more home care workers? And a bunch of them said, because we think it's unethical to train people to go in a profession that pays so little and there's no room for advancement. For ethical reasons, we're not training home care workers. That's where we are. That's how broken the system is. And so we have a lot of work to do.
Yeah.
really educate folks.
Ai-jen, are there models of stuff working, initiatives working, not just at the federal level, at the level of policy, but at the level of practice where you are?
Yeah, so I think Washington State is a great example of a place where the Service Employees International Union has built a really strong home care workers union. And they have also built a very strong training institution that is the second largest educational institution in the state after the University of Washington. They train 40,000 home care workers a year in 12 different languages with continuing education in the form of pop-ups in rural communities. And the starting wages for a home care worker in Washington as a result of the power that this union has built are 17 an hour, and they have not only health care and paid time off, but they also have retirement benefits. And as a result, Washington State is among the most prepared places in the country for the coming demand for home care. They actually have a workforce that is strong and getting stronger. So I mean, obviously $17 is not enough, but it's a starting salary and they've come a long way, and it gives you a sense of this is possible. We can do this. And that is what the Build Back Better investments would enable, is states around the country to really take up modernizing access to home and community-based care and strengthening the workforce in ways that are really 20 years overdue.
Can we talk about the scandal in seniors care facilities in New York State during COVID? I'm sure that's in the back of people's mind as they hear this conversation. It's like, yeah, I want senior care, I want better care, but weren't those centers a sort of locus of death for a lot of elders? Why would I either want to work there, send my senior there, or really care? Ai-jen.
One of the reasons why I got so involved in expanding access to home care was because my grandfather was in a facility like that. When he lost his vision and had all kinds of complex health issues, we couldn't find the right home care support for him and had to place him in a nursing home against his wishes. And visiting him there was the single most heartbreaking experience of my life. And I'll never forget it. Being in a room where all of these elders who have given us their lives are living in the most undignified conditions, supported by a workforce that is given absolutely untenable responsibility to care for dozens of people every hour. It's literally impossible. And I'm not saying that every facility is that way, but this is pre-COVID, right? This is many years before COVID, and there has for years been a movement called the Culture Change Movement to try to change conditions within nursing homes because of the devastating and undignified conditions in so many of these facilities. So I can only imagine what the additional pressure of a pandemic did to these facilities and the people who work in them and the people who rely on them. But Phil, I'd love to hear your thoughts.
One of the problems in New York nursing homes is that it's become a profit center for for-profit private equity, and they get into nursing homes and they pare down staffing in order to increase profits. And we're also seeing private equity firms buy nursing homes because they want the underlying real estate so they can sell off, get rid of the nursing home and then build luxury condos. And so that has been a problem for years, so much so that the unions that represent nursing home workers have prioritized staffing over their own pay when it comes to contract negotiations. And these are really low-paid poverty wage workers, but they said the care level is so bad, we have to prioritize our patients, which is incredible when you think about it. But that's literally what's been happening, in the nursing home field. So that is an underlying problem. And these same private nursing homes put a lot of money into political contributions, by the way, at the local level. And so we don't see a lot of intervention and change. It was a heroic assemblyman, Ron Kim from Queens, who really exposed this whole thing. He deserves a lot of credit. And actually, he's maybe the reason the governor is not the governor anymore, because of what he did. But he just said, I don't care if I'm reelected. I just don't care. This is wrong. We have to take a stand. I think ultimately we have to federalize funding for nursing homes and home care, because right now you need a state match for funding. And I just think that's dysfunctional and makes it subject to a lot of political stuff. And we need to take this issue as one that's about our loved ones. As Ai-jen said, it's about who we are as a people, as a nation. These are our loved ones, the ones who raised us, who cared for us. We're not going to throw them away because they're not profitable.
Yeah. Ai-jen, you want to weigh in on this?
I think that the time is now. Right now, you'll hear a lot of media coverage of the so-called Great Resignation. Some people are calling it the Great Renegotiation. But we have a moment where tight labor markets are giving workers more leverage, and workers are not standing for poverty wage jobs where they're disrespected and undervalued. And so more organizing is happening than ever before. This is a moment to disrupt anti-union narratives that have been seeded by big business over the course of the last 40 years and help people organize, help us build, strengthen, explode this labor movement into a movement that can actually restore the dignity of work in this country and win the care infrastructure that we need. This is the moment to do it. And the only way we do it is by talking to each other. To Phil's point, is there is not a single group of special interests or constituents who is powerful enough to do the job alone. We actually need each other. And you can see it in our own homes, the way we rely on each other across class, across race, across community when it comes to care. That's just the reality, is that we are interdependent. And the only way we build the society that we deserve, whether it's the economic frameworks or the democracy, is through engaging each other in meaningful, authentic ways and building together.
The CUNY School of Labor and Urban Studies is the 25th and newest school under the CUNY umbrella. Dedicated to public service and social justice, the CUNY School of Labor and Urban Studies offers undergraduate and graduate degrees in the areas of labor studies and urban studies, and certificate programs in labor relations, public administration and public policy, healthcare policy and administration, and community leadership. We pride ourselves on being an institution that brings together activists and academics. Find out more at slu.cuny.edu.
We're looking at the alarming reality of America's elder care crisis, and we're joined now by Maggie Ornstein. Her work encompasses individual and public policy advocacy related to the delivery of long-term and end-of-life care. She's a certified brain injury specialist and public health geographer. She is also very personally connected to this story, having cared for both her mother and her grandmother. Thank you, Dr. Ornstein, for joining this conversation. And this week that we're talking marks an important moment in your family's life. Tell us a bit about your mom and how she came to need the care that you've been so actively working to provide.
Yeah, so last week was the 26th anniversary of my mom's aneurysm rupture. So when I was 17, a senior in high school, she had an aneurysm rupture in her frontal lobe of her brain that left her in a coma and minimally conscious state and on life support for 5 months. And so that was a few weeks before my 18th birthday, and I've been caring for her since.
Now, you've seen the difference in your mom, both in an institution and at home. We've been talking a lot about home care in this conversation. Why was that what you worked so hard to have a right to provide?
So, we know that family members take a whole lot of care of people when they're in institutions as well. We know that people want to be at home to receive their care. And, 4 years of my mom being in a nursing home, I was with her all the time, every day there, doing a lot of the work that workers there were too overburdened to take care of. And, at one point I said, why are we sitting here? Why am I here with you in this place when we could be at home when I'm doing so much of, the labor anyway?
So you go from being a teenager, looking after your mom in an institution, to having her home with you in a house that's not designed to have so much caregiving going on, to having your own life sandwiched in between the lives of people who are depending on you. Were you also able to bring in paid caregivers to help?
Yeah, so it's been over 25 years. So the first 5 years was institution care, and then 5 years of, the first 5 years we dabbled with home care, and it's really hard. People don't want, my grandmother didn't really want strangers in the house. You hear this all the time. And so we would try, and it was really difficult because of, and I kind of had forgotten this, but thinking about Fair Pay for Home Care and the campaign that we're working on now, the reason it didn't work was because of high turnover. So we would have somebody come in, and it would, we would get them to a point where they knew what was, what the household needed and what my mom needed, and then they would kind of disappear, right? And I think I didn't put it together at that point when I was 20 years old, but the low wages really results in a high turnover. And so we definitely felt that for the first 5 years. My grandmother broke her hip when she was 99 and was mostly in bed at that point. And this wonderful woman showed up from an agency, and my grandmother liked her and she was great. And I said, do you want to work full time? Can you stay? And so she now has been with us for 13 years, which is just, stability that is very rare in this.
So you've gone from responding to a crisis in your family, to caregiving, to finding out a bit more about the people that provide care at a professional level, to becoming an activist and an advocate. And we should say you also work with JFREG, the Jews for Racial and Economic Justice. Can you talk a bit about what you've learned from the personal, about the policy, about the political, if you know what I mean, and what needs to be done?
We have a long-term care system now that relies on exploited labor. So underpaid home care workers who, get poverty wages, and, the work is not dignified. People don't treat it as real work. So we have underpaid home care workers. And then we have, in New York State, there are 2.5 million family caregivers who contribute $30 billion of care every year, right? And so the long-term care system is subsidized and supported by the exploited labor of family and paid caregivers. And I think what I feel is really important is we need those two groups. Paid and family caregivers, when it works well, they are really essential to each other, right? From a mental health perspective, it's an isolating job for anyone who's doing it. So having the support of somebody else coming into your home, and that's why the turnover is such a big issue, right? Because it's really a lot of work for family members. If there's a family member involved, it's a lot of extra work managing that relationship. And if it's a new person coming in, every week or every couple of days, people really just say, they bow out and they say, I will quit my job and I will do this myself, because of the way that services are provided right now.
And then the people that do it themselves don't necessarily have the training, the expertise, or any of the techniques that you need to do it well for your own health and for your own mental health. What can people do who are going through this right now? What can they do to keep themselves, sane and keep themselves as happy and healthy as they can in this situation, and the people they're caring for? And then how can they connect at the policy level to work with you, perhaps, to get organized? Because there's constantly this personal and this political side to this story.
Yeah, so there's a whole lot about self-care, right? I think that it's really hard to engage in self-care if we don't have the structural supports needed. So that's a lot of talk without a whole lot of action, right? I advocate on the federal level also, but at the state level right now, we need to convince Governor Hochul that fair pay for home care there is no question about this, right? We have huge support from both the Senate and Assembly. We have majority support. It's bipartisan support, right? Across the aisle, Democrats and Republicans understand that this is a win-win, right? There was an SLU report that was put out showing that a $2.5 billion investment would result in more than $5 billion in economic growth for the state, right?
That's
so this is
from the School of Labor and Urban Studies.
Yeah. So why are we even questioning policies like this, right? And we've just heard Target is raising wages to $24 an hour. Home care workers are not going to keep working for $13 an hour when they can flip burgers or do customer service for a lot more than that, right? So, the New York Caring Majority, nycaringmajority.org, there's a whole lot of stuff right now. We're doing an action a day to really push Governor Hochul to include this in the budget.
That's it for our show today. Thank you, Maggie Ornstein, for joining us. And if you out there have questions or comments, write to us at cityworks@slu.cuny.edu. For CityWorks, I'm Laura Flanders.